I'm Chris, and today we are going to be talking about sleep apnea. I wanted to take a quick moment to remind everybody that this is not a channel to help you diagnose yourself. If you feel that you have any of these conditions or diseases, please consult your primary care provider or medical team so that you can appropriately be diagnosed and treated. This channel is solely meant for education so you can better understand these disease processes, their treatments, and complications that follow. So, what is sleep apnea? Sleep apnea is a sleep disorder in which the breathing either stops or becomes very shallow throughout the night, and it can affect the way our oxygen and carbon dioxide exchange in our sleep. This may happen dozens to hundreds of times throughout a sleep cycle, and it can affect your entire body's functions. There are two primary types of sleep apnea, and that's going to be obstructive sleep apnea and central sleep apnea. So what is apnea? Apnea is whenever we have a pause in our airflow for at least 10 seconds. You stop breathing for at least 10 seconds. That would be considered an apneic event. There's also hypopnea, which is a partial reduction, where there's a restriction in the airflow and shallow breathing, but not necessarily a cessation of air. So let's start off with the more common obstructive sleep apnea. So obstructive sleep apnea is a mechanical airway obstruction, which is essentially meaning that there's something in our body blocking the airway. Our neurological status is telling us that, hey, we want to breathe, but there's something preventing it. And with our body in a very relaxed state, doesn't necessarily force the air through until too much CO2 gets there, in which we kind of wake up just a little bit, a very micro arousal event, and then we gasp for air. So why does this occur? This occurs because we have a lot of soft tissues in our neck, and whenever we become relaxed, they become relaxed. And whenever they relax, especially whenever you're lying flat on your back, they just tend to fall back with gravity, and that is the tissue that will usually actually obstruct the airway. Whenever you get those little micro arousals, all those tissues kind of stiffen back up and pull away from the airway, allowing you to breathe again. But just remember, it has nothing to do with your neurological state or anything like that. It is solely just because your body's in a relaxed state and your own tissues are blocking the airway. And that's how the big difference between that and central sleep apnea. Central sleep apnea is not because there's a blockage in the airway. It is a problem with the way the brain is working. The brain is not sending the signals to your diaphragm and muscles that control your lungs. It is absent. It can be caused by medications. It can be caused by injury to that area, a few other different things that affects the breathing mechanics, which is going to be the pH value of the blood. The lower amount of CO2 in your blood, the lower the acidity in the blood, and the lower the acidity in the blood, it will affect the way your brain recognizes its ability, want to breathe. So, big difference. One's neurological, which is your central sleep apnea. One is caused by a mechanical obstruction, which is obstructive sleep apnea. So, what happens during sleep apnea? Whenever you have sleep apnea, your oxygen levels will drop. Your carbon dioxide levels will rise. You have an activation of the sympathetic nervous system, which is the fight or flight response. That kicks in, pushes a little bit of adrenaline through your body, which causes your heart rate to go up. It causes your blood pressure to go up. Constriction of your blood vessels, which causes your blood pressure to go up and affects the way that our body perfuses. And you're also, with these micro arousals, it's getting you fragmented sleep, which affects your sleep quality. So what affects obstructive sleep apnea? Why does this, who's the most at risk? Your most at risk people are going to be the people with obesity. And the reason why is we're talking about basically tissue structures in our mouth, in our throat, that's causing this collapse in there, which narrows the airway. People with more fatty tissue has more tissues that can be used to block the airway. Somebody with a very round neck, a thicker tongue, more just tissues around the airway in general. These are all things that can be affected, and it can be directly related to your weight. Other things that are a little bit less controlled is going to be like large tonsils and large adenoids, a large tongue, small jaw, recessed chin, narrow airway, and those are some of the ones that you'll actually catch sleep apnea at a very young age, because it's more of a structure of the way our mouth and jaw and airway and everything is actually built. It has nothing to do with weight. It has very little to do with necessarily the tissue. It's actual structures that form everything. There is tissue still involved. However, you can't do too much to affect this. You can have your tonsils removed and things like that. You can have other procedures done, but generally that's not something you can just go off and do on your own. Other things that can actually cause sleep apnea is going to be stuff like allergies, because that's going to increase inflammation. That's going to be in your nasal canals and your throat, and that can alone be enough to cause sleep apnea. Other things that can affect it is going to be alcohols and sedating medications, just because relaxes you even more, and it can allow those tissues to droop even more. And what's happening during central sleep apnea? Well, this is usually going to be because of medications, an injury to the brain that controls the signal that sends out to start breathing, or it could be due to high altitude or maybe excessive amounts of breathing. So what do I mean by that? Our brain actually tells ourselves to breathe. It tells it how fast to breathe, judging by the pH in our blood, which is usually controlled by the amount of CO2 in our blood. So if you're breathing very rapidly, especially in high altitudes where there's less oxygen and you're having to try to breathe more to breathe in more oxygen, your body will actually push off more CO2, which is going to not artificially, but it will cause your pH to go down, which actually cause it to go up. Sorry, backwards. It'll become more alkaline. And then your brain's going to be like, hold up, breathing too fast. We need to stop. And it will actually take away your drive to sleep. And that can happen in CSA as well. And definitely during one other condition that we're going to talk about more here in just a little bit. And then also just dampening out the want to breathe is going to be like the injuries in the area. It can make it a little harder for those signals to get by. Medications can sometimes make it to where that threshold of where the brain sends out that signal is even higher. And you have to really, really build up a lot of pH to be able to get that signal across. So the biggest things that's going to affect central sleep apnea is going to be heart failure, opioids, strokes, and brain injuries to the medulla oblongata area, neurological disorders such as ALS, myasthenia gravis, myotonic dystrophy, spinal muscle atrophy, like I said, high altitudes. And then there is one more, and this is actually going to be a CPAP. A CPAP while treating obstructive sleep apnea can sometimes blow off an excessive amount of CO2. This does not happen very often, but it can. And when it does, it can actually cause central sleep apnea. And whenever you have both obstructive sleep apnea with central sleep apnea, due to this, it is called a complex sleep apnea. So that's kind of the gist of central sleep apnea. Like I said, it is a neurological disorder that causes, or neurological thing that causes central sleep apnea. Your brain is not sending the signals to the muscles, or the muscles aren't firing to breathe. It's not that you're not trying to breathe. No, it is that you're not trying to breathe. It is not like obstructive sleep apnea where you're still trying to breathe, but you're failing to. What are going to be some of the symptoms we might actually have with sleep apnea? Well, most of them are going to be you're going to need a second person for the majority of these. They're going to either witness you not breathing, very loud snoring. You may be waking up, gasping for air, things along those lines. But as far as like you yourself being awake and being able to tell, it's going to just be that be feeling tired, irritable in the morning. You're not able to concentrate, things that show that you didn't have a great quality of sleep. It's not very easy to recognize on your own. But if you have somebody that says, hey, you stopped breathing for like 20 seconds last night, I thought you died. That's probably because of sleep apnea. And you need to get that checked out so you don't get those long-term complications that come with sleep apnea. Complications that can happen due to sleep apnea. I know I kind of briefly said that it affects your entire body. Cardiovascular wise, what it will usually do is it can start high blood pressure. It can cause you to have arrhythmias such as AFib, bradycardia. It can actually cause heart blocks and ventricular arrhythmias, which is a very lethal rhythm. But usually AFib is the one that's the most associated along with bradycardia. It can worsen heart failure, mostly due to that blood gas exchange and the increase in blood pressure that really affects your hemodynamics. That is going to affect an already failing heart. And it can increase your risk for stroke. If you do get the AFib, it increases your risk for clots. The cortisols increase your risk for developing clots. If you have a high blood pressure, it affects the vessels and it can make them small and fragile. Lots of things happen with that. Other things that can happen is with the poor quality of sleep, you're going to see more instances of depression and anxiety, memory impairment, mood instability, and just the overall cognitive decline, especially whenever you get up in age. The biggest metabolic complications you're going to have is it can increase the insulin resistance in your body, making your diabetes worse. Those cortisol levels is also going to increase the amount of blood sugar, cortisol, but your adrenaline that's being released during sympathetic systems activation is going to cause for higher blood sugars. And it just overall can make it a little harder to treat diabetes or worse than your diabetes. Or if you're pre-diabetic, it can actually cause you to push over into full-blown diabetes. You also have a full weight gain cycle. You have fatigue, meaning you're not going to be as active. You have the hormone imbalance due to this, which affects your appetite and can affect the way you metabolize things. And you're going to have a worsening in obesity, which is going to worsen the obstructive sleep apnea. It's just a full-on cycle. Increased sugars, decreased activity, decrease ability to burn the sugars, get bigger, worsen the sleep apnea, and then just on and on. It's a downward spiral from there. Plus, if you're having a lack of sleep, it can affect the way you pay attention like at a job. So if you work around heavy equipment, you may not be paying attention to stuff like that. If you're driving, you can fall asleep behind the wheel. And just overall in your day, you may not have much of a productive day. So what are our diagnoses for these? Like, how do we as healthcare workers diagnose this? Well, we're going to start off with the questions. We're going to ask you about snoring, how's your sleeping, what medications you're taking, things like that. After that, we'll do a sleep study with a polysomnography. And what that's going to do is it's going to monitor your brain activity, your oxygen levels, how much your chest is moving up and down, so we can recognize when you're either not taking a deep enough breath or whenever you just have a full cessation of breathing. It'll keep track of your cardiac rhythm. And basically what we use with that is how frequently these apnea events are happening, how much your body's being affected by it. And it kind of gives us an idea of, is this something that actually needs to be treated? Or, yeah, you stop breathing like 2 times a night, but you're fine. It's not going to make a overall large impact on your body versus somebody that may stop breathing 2-3 times a minute. And that's a lot of time while you're asleep to not breathe. And then they have like a full index that they base things off of, how severe the symptoms are. I'm not going to get too much into that because that does not going to matter for actually understanding sleep apnea or treating it. Maybe a little bit into the treatment, but either way, the biggest treatment for obstructive sleep apnea, 1, lose weight. The other big one is going to be, they're going to start you probably on a CPAP, which is a continuous positive airway pressure. And what that is it's a mask or a nasal pillow that will go over your face at night and give you continuous airflow. The purpose of this is not necessarily to give you oxygen or extra air or anything like that. It is to force open the airway. It's a very small amount of air that's continuous, and it's just to help push those tissues out of the way. That way your airway remains open. So that way, while you're sleeping, you have no trouble getting air in or out. And it's not meant to necessarily ventilate you, force you to breathe, or anything like that. It's just there to keep tissues out of the way so that your body can naturally breathe. Depending on what settings you require is going to be how your CPAP is set up and how much air is required to keep those airways open. We go with the lowest amount possible. That way everything is affected by you. If you do wear oxygen, there is a way to bleed in oxygen for these machines. So there is a mechanism to deliver oxygen. However, that is not the primary purpose of a CPAP. I've already talked about weight loss. We have other oral things that you can do. There's actually some things that can help hold the jaw forward, which will help keep those tissues out of the way. There's different devices that you can put to help try to manage your airway. And then also changing the way you sleep. As I said, sleeping on your back is going to be the most harmful way, like the least effective way to prevent this. If you were to turn onto your side, or if you have a bed that can raise up, anything that will keep the tissues from just falling straight back to the back of your throat is going to be helpful to try to prevent the sleep apnea. It may not work 100% for the majority of people, but it may be better than just laying flat on your back. You can have surgeries done, especially if it's going to be something more than just the amount of tissue around your tongue and neck. Like if you have the tonsils and stuff like that, you can have some of those structures removed. That way it will help with prevent those obstructions. There is some nerve stimulators out there as well that will help keep those tissues stiffened up. That's not something I've seen personally very often. I know that they're out there, but it's unlikely that it's going to be something that they go straight towards. And then, of course, some of your other lifestyle modifications, such as if you are having things like alcohol affected, stop drinking, stop smoking, because it can cause the inflammation back there, making the swelling and tissues thicker than what they need to be. Practicing some sleep hygiene. And then if you're taking like any opioids or anything like that, obviously try to cut back on those. So the other thing about CPAPs, since we were talking about that earlier, one of the things that is going to be very mindful for you, make sure that we're keeping the CPAP, especially the mask, nice and clean. That'll help prevent some irritation, mold developing. There is a filter on the CPAP to help keep the air that's being forced through the machine. It's right there usually on the side of the machine, and that should probably be changed out about once a month, depending on what the manufacturer guide tells you. And there's also water that usually is added to CPAP machines. That is to help keep your mouth from drying out. Whenever we breathe naturally, we use the moisture from our mouth and our nose to help moisten the air. Without having all of that there, if you're just forcing air consistently, it'll dry all that out very quickly, and then it can actually dry out your airway, it can dry out your lungs, and it can be very uncomfortable. That's why most CPAPs have a reservoir for water, and you shouldn't be using tap water. It's not that you can't, it's that it will affect the longevity of your machine. What happens is, especially places with hard water, it will build up calcium deposits in the machine, which will over time damage and break the machine. You should be using distilled water in these machines to prolong the life of the machine. These machines aren't cheap, and most people aren't just going to go out and buy a bunch of different CPAP machines just because they've decided to fill it up with tap water. It's much cheaper and effective to use distilled water, and a gallon of distilled water will last you many weeks. I know that the biggest issue with most people is going to be the mask itself when treating sleep apnea. There is other options other than the mask. There's nasal pillows. There's like the mask, the nasal mask that completely covers the entire nose. And then you have the other mask. Make sure that these masks are fitting appropriately, not too tight, not too loose, because if it's not too tight, air can sometimes come out between the mask, which can be very irritating, especially to the eyes. And if it's too tight, then that's just, especially if you're claustrophobic, it's going to really put pressure into these areas, especially across the bridge of the nose, which can actually cause a pressure injury, which means it's going to damage the tissues to your nose. And that's going to be very uncomfortable to deal with. And on top of that, you'll have to deal with that sore there for a while. So make sure that we're fitting our mask appropriately, right size mask, straps aren't too tight. You should be able to fit 1 to 2 fingers in between the mask, and you shouldn't have an excessive amount of air coming out. And then CSA treatment, if we have you on opioids, cut back on the opioids. There is a machine that can actually help with positive airway pressure, but it is very, very rarely used. It's called an ASV, an adaptive seroventilation unit. And the reason why this is rarely used is it can really affect the heart. It is a last resort. Only use it in this situation if it's bad enough to where you absolutely need the machine. And the reason why is it affects the way your heart pumps. And whenever you do that, it can actually cause your heart to stop beating. It will cause cardiac arrest. And it's one, a very expensive machine, but 2, it's just such a high risk machine that there has to be a very strong reason to put somebody on it before they will. Now, if you need it and they prescribed it, there must be a very good reason. But generally, you're just going to continue on with like a regular CPAP if that's what you have, or you could use a BiPAP. Still not the best thing on there. Generally, we're just going to be trying to reduce the amount of respiratory suppressants we have you on and judge treatments based on what your actual condition is at that time. I think that that's all the really big things to cover over here. So this video went on actually longer than I was hoping it would, but it is what it is. I think I covered the majority of the stuff. If you have any questions, let me know. Maybe I could do a follow-up video. If there's something you like about this video that I did very well in, let me know. If there's something that I didn't do too well in, tell me that I covered something too much times or something like that. Something was just very hard to understand or hard to follow. Let me know what those are. I'm trying to make these videos for you easier to understand. That way you can help learn about this stuff. That's the whole goal. And if you're not doing that, then I need to change what I'm doing or how I'm doing it. But anyways, thanks everybody for joining. If you like the video, like it. If you dislike it, hit that dislike button. If you want to see whatever I post in the future, hit that subscribe button and you'll see whatever I post in the future. Otherwise, y'all have a wonderful day or night, depending on where you're watching at in the world. And until next time, I say goodbye.